Okay, hi guys. I really wanted to teach you this in person since I already had to postpone it to this week, and then the weather happened. So we're gonna do it this way, but before I get started, my daughter wants to introduce herself. She wants to meet you guys virtually. Come here. Okay.
Hi!
Okay. All right, there's Jocelyn. Okay. All right, Joss, move. Great. Mark, you want to get introduced to the kids?
Sure.
Okay, this is my fiance, Mark. Here we go. Sorry, we're just at home, like, cooking dinner, but I wanted to get this on there. Hi, everybody. Okay. Very fun. Okay, so first of all, I told you guys to read the pediatric prescription handout. I sent you a reminder on Friday, so I hope that you guys all did that. I'm going to do a couple examples with you, and then I will be on Zoom 8:30 and 1:30 if you guys need help. So this you should have already read, but what I'm going to refer back to is the purple little chart on the back, which is a chart for prescription abbreviations. What you're going to be filling out is the patient assessment form, and that is one of the attachments on Google Classroom. So if you guys can print it and write on it, that's great. Or if you want to open it as a Google Doc and type, that's great too. Okay, so this is what you're actually turning in. Next thing, I have the doctor's orders, and then also the actual prescription bottles with the strengths of the prescriptions. So you'll need to refer back to that as well. Joss, stop touching it, please.
Okay.
Okay. So first example, again, I'm looking at the patient assessment form, is Gabriel King, who is a 7-year-old. His chief complaint is ear pain. When asked about what his pain level was, it was an 8 out of 10. And so the symptoms are Gabe has severe ear pain that gets worse when he lies down. The pain is in his right ear. So next to that, there is a diagram, and that's anatomical man. And so anatomical man, if you're in PBS, hopefully you've learned this, but anatomical man is when we're standing like this. This is anterior position. When you're standing like this, it's posterior position. Okay? So anterior man, we're going to mark with arrows where his pain is. So for Gabriel, he has pain in his right ear. So in anterior position, the arrow is pointing at his right ear, and posterior position, the pain is pointing to his right ear. Okay, so you guys are going to have to mark on there where the pain is noted. His medical history, he has had a broken arm in the past. He doesn't have any current medications. His weight is 48 pounds. Now, something that's important to note is that pounds is not an SI unit or a standard international unit. Remember, we're kind of snobby in America. So we have to take that SI unit we have to take that pounds and convert it into an SI unit, which we've learned doing dimensional analysis. And I'll go over all that with you in just a second. His height is 47 inches. His blood pressure is normal. It's 100/58. And the doctor noted that he has an infection. So what we're going to fill out on this patient assessment and prescription form is the drug. I'm going to show you how to find that. We're going to do the dosage count. You're going to actually make out the prescription label that will be sent to the pharmacist. Okay? So if you look at this attachment that has the doctor's orders, and sometimes doctors do this themselves, and then sometimes doctors have nurses do this for them. Okay? So I'm looking for one that says for infection, and the top left one says amoxicillin. At the bottom it says for infection. So that's what we're going to start with. So if I'm doing the dosage count, the first thing that I have to do is I have to take his 48 pounds and I have to turn that into kilograms. So dimensional analysis tells me there are 2.2 pounds in 1 kilogram. But we can't stop there. We have to keep going. So the doctor is ordering 40 milligrams per 1 kilogram. And how I know that is looking at this sheet right here. It says amoxicillin 40 milligrams per kilogram per day for 10 days. So the doctor is ordering 40 milligrams per kilogram. That means I have to put kilogram at the bottom because I need to cancel out this kilogram, and 40 here, milligrams. So the patient weighs 48 pounds. We need to convert that to kilograms. Then we need to do the dosage to figure out how much in milligrams he's going to get. But we need to take it one step further because we need to figure out how many mils total that patient is going to get. So if I'm looking back at the doctor's orders right here, I need to, I think this is a 2-page, sorry, I have it physically, but I know it's an attachment on Google Classroom. But amoxicillin is, right down here on the bottom, it's 125 milligrams per 5 mils. So I need to cancel out this milligram, 125 milligrams in 5 milliliters. Sorry for my ugly handwriting. Again, I'm working at home on the fly. So remember, I want you guys to get used to, let me grab another color. I want you guys to get used to actually crossing off those units. So pounds cancels, kilograms cancels, milligrams cancels, and that leaves me with milliliters, which is what I need. I need to know how many milliliters is little Gabe gonna get each day. So when I do my math, 48 times 1 times 40 and times 5, and then 2.2 times 1 times 125, and then I divide those two numbers together, that gives me 35 mils. Remember, that's my only unit that's left, and that's gonna be per day. If I look at the doctor's orders, again, I'm looking right here, it says 40 milligrams per kilogram per day for 10 days. Right here it says BID, PO, PC. So if you look at, too many attachments, if you look at the prescription abbreviations, this is going to tell you what all of that stands for, in other words, and most of it is Latin based. So BID means twice a day, PO by mouth, what was the other one? And then PC means after meals. So BID, twice a day, PO by mouth, PC after meals. Meals, not meals. Okay, so if Gabriel is getting 35 mils in one day, and this doctor wants it twice a day, the dimensional analysis would say that in one day, because I want to cancel out days, he is going to get 2 doses, because that's what BID means. So again, we're getting very used to crossing out our units. The only thing that can cross out here is day and day, so that leaves us mil per dose. So whenever I do that math, 35 times 1 is 35. 35 divided by 2 is going to give me 17.5 mils per dose. 17, sorry for my ugly handwriting, working in my kitchen, but 17.5 mils per dose of that amoxicillin, which I'm sure you guys have had amoxicillin, that yucky, like bubblegum tasting stuff. So if he's getting 17.5 mils per dose. So now we need to actually write out the prescription label. So on the prescription label, which again, I'm looking at my patient assessment and prescription form, so we need to fill out the actual patient label. The medication is amoxicillin, but I can't just say amoxicillin because it comes in lots of different strengths. So again, I have to refer back to what did the doctor order, and this doctor ordered, I have to look back at the bottle, and the amoxicillin comes in 125 milligrams and 5 mils. So that's what I'm going to write, so we know there's different strengths. So the pharmacist needs to know what he's going to draw up is amoxicillin 125 milligrams and 5 mils. And then what I need the directions to say for Gabe's mom, dad, grandma, grandpa, whoever's giving him the medications. So what's really important to know is that we always say how much the patient is going to take. We always say what route. Is it by mouth? Is it IV? Is it IM or intramuscular? Is it sub-Q, subcutaneous? Okay, so we need to know what route is it being given, how many times a day it's being given, how long if that's specified, and if there are any other specific instructions like with meals or until gone or something like that. So for little Gabe, he's going to take, hopefully we know now, 17.5 mils. The route is by mouth. It said BID, so that is 2 times, time starts with a T. 2 times per day. But remember, the doctor's orders also said PC, which means, or for 10 days, and also PC, which means with meals. So take 17.5 mils by mouth, 2 times per day for 10 days, because after 10 days, he's going to discard what's left with meals. And then you always have to say what it's for. And I've noticed on some of my prescriptions, sorry, I dropped my eraser, that sometimes it doesn't say what it's for, but it's important, especially for people who are on a lot of medications, that they're able to see, hey, I'm taking this medication for this purpose. So for Gabriel, it's because he has an ear infection. So we're going to put for ear infection. Did they put, yeah, they did. For ear infection. So I did the dosage calculation in order to figure out what his dose was going to be. I have to tell the pharmacist, okay, this is the medication, this is the strength of it. I have to tell the person taking care of that patient exactly how much to give, what route to give it, how many times per day, anything else that's specific, like the amount of days, with meals, things like that. I'll go over another example with you, and specifically what it's for. So I know I'm going quickly, but you guys are welcome to rewind this video, watch it again. I'm going to do one more with you, then I'm going to set you free, and you can join me on Zoom at 8:30 or 1:30 if you need specific help. So moving on to little Jeffrey Summers, who's 6 years old. His chief complaint is rash and itching. When asked about his pain level, he said 6. His symptoms, rash and itching along arms with a few patches on the legs below the knees. Again, anatomical man is standing this way, so if he has rashes on his arms and his legs below his knees, you're going to have to put the arrows pointing to both arms, pointing to both legs below his knees. Posterior position is this way, again, arms and below the knees. Make sure we're putting the arrows in the right place. His medical history, Jeffrey has been found to be allergic to certain grasses. He currently takes Zyrtec daily for mild allergies. He weighs 45 pounds, his height is 43 inches, his blood pressure is normal, 96/55, and the doctor has diagnosed him, put the note in here, as having an allergic reaction. So we need to then look and see what drug is going to be prescribed for little Jeffrey. So I would need to look for something that says allergic reaction. If I'm looking on my doctor order sheet, right here, diphenhydramine, it says for allergic reaction. Diphenhydramine is the generic drug name for Benadryl, which is the brand name. Okay, and it says 3 milligrams per kilogram per day, TID-PO. So Jeffrey weighs 45 pounds. The first thing we need to do is dimensional analysis to change that into kilograms. 2.2 pounds in 1 kilogram. Then I need to look at the doctor's orders again. It says 3 milligrams per kilogram. I need to cancel out this kilogram. So kilogram goes on the bottom. Milligrams goes on the top. Then I need to flip this over and I need to see what strength is the diphenhydramine. So it's the top left. It's 1 milligram per 1 mil. So I need to cancel out this milligram. 1 milligram goes on the bottom, 1 mil goes on the top, and I need to do my math. Remember, we got to cancel out our units. Pounds cancels, kilograms cancels, milligrams cancels. That's going to leave me with milliliters. So 45 times 1 times 3. That's 135. Divided by 2.2 times 1 times 1, which is 2.2. Remember, I can't stop there. I have to do the final math. So when I take 135, I divide it by 2.2. That's going to give me 61.4 milliliters per day. But again, doctor's orders for that diphenhydramine say that he's going to get that TID. So I have to go back, if I don't have this memorized, to the prescription abbreviations. And TID means 3 times a day. Okay, so he's going to get this 3 times a day. So now I have to take that 61.4 milliliters, and he's going to get that over the whole course of a day. I'm going to cancel out each day. He needs to get this in 3 doses because it said TID. When I cancel out my units, the only thing that cancels is day. That's going to leave me with milliliters per dose. 61.4 times 1 is still 61.4. 3 times 1 is still 3. So all I'm doing is I'm taking 61.4 and I'm dividing it by 3. And that's going to give me 20.5 mils per dose. Oh my gosh, my handwriting is horrendous. I need a bigger whiteboard. But remember, I can't stop there because that doesn't mean anything to a parent who's treating sweet little Jeremy for his allergic reaction. So if he's getting 20.5 milliliters per dose, I have to then make this prescription label and send it over to the pharmacy. So the medication is diphenhydramine. Again, the brand name of diphenhydramine is just Benadryl. And diphenhydramine comes in lots of different strengths. This one particularly, again, because I'm looking at the bottle, comes in 1 mg per mil. That's what the doctor wants, so I have to specify that to the pharmacist, 1 mg per mil. If you buy diphenhydramine over the counter, it's 12.5 milligrams in 5 mils. So this is a little weaker of a dose than what you can get over the counter. And then the directions, remember I need to start with how much Jeremy's taking. So he's going to take 20.5 mils by mouth. Then I have to, remember I have to include the route. How many times a day? He's going to take it 3 times per day. And then we have to say what he's taking it for and for allergic reaction. Woo! The ugliest handwriting I've ever had. Okay, so again, that's what gets sent over to the actual pharmacist. If you guys keep on looking at the patient assessment and prescription form, the next one is Saul and then Olivia. One thing I want to tell you about Olivia is on her orders, heads up, she's going to get morphine. There's a little bit of a typo. It's not going to go IV because the morphine says that it's oral suspension. We're not going to take that bubblegum flavored morphine suspension and give that to her IV. So I want you guys to change what says IV on the morphine from the doctor's orders to PO. And notice it says every 2 to 4 hours. The orders from the doctor says 0.05 mg per kg per dose. So this time it's not per day. So be mindful of that. We're not going to get poor little Olivia doped up on morphine if she doesn't have to stay doped up with morphine. Okay, so there's 2 examples that I did with you. If you guys need to join me on Zoom, then I can help you individually on Zoom. Thank you. Your hands are